While medication is a vital tool for managing hypertension, the lifestyle component often does the heavy lifting for long-term cardiovascular health. If you are looking to support your heart through daily habits, these 5 non-pharmacological interventions are backed by significant clinical evidence. Diet is the cornerstone of blood pressure management. The dietary approaches to stop hypertension diet emphasizes fruits, vegetables, whole grains and lean proteins. Sodium control: aim for less than 2300 mg per day, ideally closer to 1500 mg for those with existing hypertension. Potassium loading: increasing potassium intake helps the body excrete sodium and eases tension in blood vessel walls. Focus on bananas, pineapple and sweet potatoes. Physical activity makes the heart stronger, allowing it to pump more blood with less effort, which decreases the force on your arteries. Aerobic: aim for 150 minutes of moderate intensity activity like brisk walking per week. Strength training: incorporating resistance training twice a week can further improve vascular health. Weight loss is often the most effective way to see a numeric drop in blood pressure. Even losing a small amount of weight, roughly 5 to 10 pounds, can significantly lower readings. The metric: blood pressure often drops by about 1 millimeter of mercury for every kilogram, about 2.2 pounds of weight lost. Waist circumference: carrying too much weight around the waist, that is visceral fat, is specifically linked to higher blood pressure. Limiting alcohol and nicotine: both substances cause immediate temporary spikes in blood pressure and contribute to long-term arterial damage. Alcohol: excessive drinking can reduce the effectiveness of blood pressure medications and stimulate the sympathetic nervous system. Nicotine: every cigarette smoked causes a temporary increase in blood pressure for several minutes after you finish. Stress reduction and sleep hygiene: chronic stress keeps the body in a fight or flight state, which constricts blood vessels and increases heart rate. Techniques like deep breathing, meditation or yoga can deactivate the stress response. Consistently getting less than 6 hours of sleep per night is strongly linked to an increased risk of hypertension. Here is a comparison of estimated reductions of blood pressure with the interventions. Weight loss: 5 to 20 millimeters of mercury per 10 kg loss. DASH diet: 8 to 14 millimeters of mercury. Sodium restriction: 2 to 8 millimeters of mercury. Physical activity: 4 to 9 millimeters of mercury. Limiting alcohol: 2 to 4 millimeters of mercury. As a disclaimer, these strategies are meant to complement and not replace the advice of your healthcare provider. Never discontinue prescribed medication without a clinical consultation.